Hi, I'm Gregory Pope, founder of SpinalSurgeryMexico.com. Today is October the 30th, 2023. We're here to pick up Eric and his wife Becky. He's going to have 3 artificial discs in his neck performed by Dr. Mario Simone, MD, FACS, Fellow of the American College of Surgeons. And shortly you'll see us transporting them to the hospital, Star Medical, where he will be admitted. And from there, tomorrow morning, he will have surgery, and then you will see us at Casa Marino for recovery. Thank you for watching the video.
Hello there.
Does look good?
Yeah, perfect. It's a little bit swollen, of course.
Yeah, it still feels like a lump.
Yeah? But it will disappear. You're gonna know that after 1.5 months at least. Okay? Because now it's swollen and it's normal to look like lump. Right. Okay? Like big, but
yeah,
it will disappear. I cannot see the scar.
Well, it's a lot of hair there now.
No, it's not that much. Wow. Nice.
Good. You got to look for it.
That's gonna take a while because you've been like that for years.
Years.
So don't expect to have everything solved in 2 weeks.
Right.
10 days. Squeeze my hands, please. Both. Like a man.
Feels
like a real man.
Yeah. Like fungal.
Okay, like this. Up. Okay, great. Down. Perfect. Like this. Okay. Down. Perfect. Now to the front.
It hurts a little bit still, you know.
Okay.
But
great.
My range of motion, my God, has improved. You know, I can even reach behind my back. Look at this. I could never do this before.
Because of pain or the stiffness?
Because of pain and the stiffness.
Okay.
Yeah. So yeah, range of motion is good. I actually have some feeling in my fingertips again, although it's still, you know, it's a little cold and a little numb, but I think maybe that will improve in time. Maybe not. It's been so long for this nerve damage, maybe some of it is permanent. I don't know.
Sometimes it's permanent, some kind of numbness or something like that.
Right.
But you have to wait. You're only 7 days from surgery.
Right. Some people, you say you really shouldn't lift anything heavy, and I'll never have strength again, but
yeah, you will have the strength, but the main thing is that if I don't say to the patient, don't ever lift anything more than 4 pounds, they're gonna do it. And they're gonna lift 15 or 20 or 50 pounds. And they're gonna get hurt in another place of the spine. Okay, I have had patients that forgot about their surgery and lift again and have another herniated disc at a different level from the prior operation or prior surgery. Okay, remember, this is not magic, it's only surgery.
Right. It's close, but it's only surgery.
Okay.
But I thank you very much. I think you've saved my body.
Well, have a nice and safe trip back home. Hello, everybody. Here I am again in San Miguel de Allende, Mexico. I'm making a house call for our last patient, Eric Sakharov. Today, it's been 7 days from surgery. The initial plan with this patient, according to the image studies he sent before and his questionnaire, was to do 3-level prosthesis by anterior approach in the neck. One of them was C3, C4, which he had the worst problem, bone spurs that were impinging the nerve and the spinal cord. Then he had also problems between C5, C6 and C6, C7. So our plan initially was to place a prosthesis between C3-4, then C5, C6, and C6, C7, two contiguous prostheses. But at the time he came here to the hospital one day before surgery, I did a physical examination on him, and according to the studies, the image studies, and the questionnaire, and then doing the physical examination, we changed our plan because he didn't have any symptoms about C6, C7. And also, he had this short neck, which poses some technical difficulties during surgery because when a patient has a short neck, you cannot take out the shoulders to get the x-rays through and see the spine correctly. So we never put in risk a patient if we don't have the image perfectly set during the operation in order to put the prosthesis. Because if we don't have that image, we could have problems during the placement of the prosthesis or the pins to take out the disc. So according to the physical examination, the symptoms, and his anatomical issues, in this case short neck, we decided not to risk the patient, and we didn't do the C6, C7 level. So at the end, we put the prosthesis between C3, C4, taking out the bone spurs and the disc, and we did the same at C5, C6, where he had the most problems. And I came here to see him and do a physical examination, and he already told me that he started to feel better his fingertips, and that's terribly awesome because he just had surgery 7 days ago. And sometimes if the patient has had the symptoms for so long, for years, it's not very easy to get relief or to get improvement in a so short period of time. So we are very glad about it. So another happy patient, thank God, thanks to our team, and spinalsurgerymexico.com is here to serve you.
Hi, I'm Gregory Pope, founder of spinalsurgerymexico.com. Today I'm with Eric. Eric is from North Carolina. We first started communicating in, I think it was July.
Yeah.
Eric needed to get some studies together, get some finances together, and come up with a date that would be good for him and for everybody, I guess. And so we went through, Eric got me all the MRI, the x-rays, the questionnaire, everything that I needed to be able to submit to Dr. Simone to make a diagnosis. Dr. Simone did a diagnosis. I sent it to Eric. Eric reviewed it. Then I set up a phone consultation for Eric to be able to speak with Dr. Simone. They decided that they wanted to go forward. Dr. Simone presented a quote on what it was going to cost him. And so Eric and me got together. We came up with a date for him to be able to come here. It was October the 30th that he went into the hospital. And on the 31st, he had surgery, recovered 1 day. And on the 4th day, he was here, which just happened to be the same day that they were celebrating the Day of the Dead. So that night we went out. He got to see San Miguel and experience the Day of the Dead here in Mexico, which is a very special day for people that live here in Mexico. But now I'm going to ask Eric some questions and let him tell you in his own words. I guess first of all, did we meet your expectations?
Oh, by far, above and beyond. What you get for what you need is above and beyond expectations. I've been searching around for a solution to my problems for a few years, and in the United States, it's kind of expensive. So I was trying to find alternative methods. I've tried physical therapy, acupuncture, massage therapy, all kinds of things, and nothing worked. All it did was prolong my symptoms and get me by. So when things started getting really bad is when I found Mr. Pope online, and your process is fantastic. Gathering up all the current information, sending it over for Dr. Salmon to do a diagnosis was definitely key, because I've had other doctors give me different opinions, and you know, one doctor would say this, another doctor would say that, and Dr. Salmon, he sort of combined all of those into a treatment plan, which made sense. So did the cost, naturally. Coming here to Mexico the cost was one driving factor of coming down here, so that was kind of a no-brainer. The surgery went flawlessly.
Well, not cutting things short there, but I mean, Dr. Simone is FACS, Fellow of the American College of Surgeons, and his credentials are just outstanding. I mean, his curricular vitae is 32 pages long, and it's quite impressive. And a brain surgeon. He's
a brain surgeon. Yeah, that was the biggest thing, was that my problem seemed kind of trivial based on his experience. So if anybody knew what was going on, it was going to be somebody like him. Everything lined up and made sense. And like I said, the process of gathering all this information that I had gotten over the past 3 or 4 years, sending it over, and then asking for more information or updated information, because I'm sure things have changed, you know, from that time to the updated.
That's why we always ask for the studies to be within a 3-month period,
right? Because
the body does have a way of changing,
right?
And it's generally not for the better; it's generally for the worse.
Yeah, yeah. And in my case, the 1 year between X-rays was like night and day. I had gotten severely worse in a year and a half's time that you know, I wasn't really aware of. The symptoms didn't change too much, but on the X-rays it was bad. You know, disc protruding into my spinal cord. Yeah, that was not seen before.
Yeah.
But it was seen now. So on everybody's advice, you know, you better get here quick.
And Dr. Simone said that you had what they call, the medical terminology is osteophytes, but what they really are is the bone spurs.
Right.
And then that comes from the bones where they grind each other and it chips off, and that was getting into your spinal cord.
Right. Along with the hole where the nerves come out of the canal, which affected both arms, were getting smaller and smaller, and that's what's been getting worse for the long period.
That was what was causing all the tingling and the.
Not so much tingling, but the swelling, the numbness. I had no feeling in my fingertips. One hand was bigger than the other for a long time. Weakness, extreme weakness, was a really big symptom. So gathering up all that information, sending it over, getting the diagnosis, figuring out the plan of attack, getting that plan of attack approved, and then everything was just one step after the other. And for somebody like me who's very methodical in things, that process is key.
And we explained all that to you, exactly how it would go. We met you at the airport. We took you to the hospital.
Right.
We got you admitted into the hospital.
Right.
You met Dr. Simone there at the hospital. Yep. He did a physical exam on you later on in your room, whatever, because I was not there. Right. Then the next morning you had surgery.
Yep.
We always keep our patients 1 day extra to make sure that there's not any problems or anything like that. I know you were ready to go. Everybody's always ready to go out of the hospital.
Everybody was always ready to go.
But they upgraded you to a suite.
Yeah, the room was beautiful, way beyond expectations.
The hospital's a very nice hospital.
Very nice hospital, very modern.
Same qualifications as the Mayo Clinic in the United States, certification.
Right. And, don't be discouraged if you think there's a language barrier. Here in Mexico, there's a lot of people who speak English well enough, just like there's a lot of Americans who speak Spanish well enough or Mexican well enough.
Right.
So don't let that discourage you. And everything worked flawlessly. One step after the other. There were no hiccups.
Then when you got to Casa Marino,
Then we got the Casa Marino. It's a beautiful place, very, very Spanish. So coming here and seeing all that is very special for me. It's just a shame that I'm here recovering from surgery and can't really go out and explore much.
And enjoying it as much as you would
as
like
I
to.
want, right. But,
and then, of course, we provide 2 meals a day. And I think that you were you had enough left over from lunch that you could have for dinner.
Yeah.
You didn't actually have to go out, but if you did, there was a delivery menu, or there's several restaurants close by you could go to.
That's right. And, you know, even amenities you have in the United States, you can always get food delivered. You know, there's Uber Eats. You could take a taxi. There's Uber here. The culture and the language barrier is not much of a barrier whatsoever. The young ladies who cook the meals here, absolutely fantastic. If you think you've had good Mexican food in the States, you're wrong. You come here.
She is a good cook.
She is, yeah.
I did want to mention that in the original assessment, Dr. Simone thought that he might be doing a 3rd level of.
Oh, right.
And after doing a physical exam and everything else, he decided it wasn't as necessary as he thought it would be.
Right.
So he only did 2.
Correct.
So there was a refund coming to you.
Right.
And when you came into Casa Marino, I handed you a check.
That's right.
So
for that difference.
I want people to know that we're not here to take your money or anything like that.
Right.
If there's 2 different of opinions on it could be this or it could be that, we always charge the most, but then if he does less surgery, we refund the money.
Correct. Yeah, that some people might get discouraged about that aspect of this, but because it does add up to be quite a good chunk of change. Like Greg said, the range given at the initial diagnosis is a range because you don't really know what's going to happen until you open somebody up. Things could change in a drop of a hat.
Right.
So there's a range to cover that. In my case, he only had to do 2. The 3rd one wasn't really that important. It was a little bit difficult for them to get to it. So he says, well, you know, let's not do that right now. And I was given a refund check because it wasn't necessary at this time, which I appreciate immensely.
Everything that we said we would do, we have done.
Right. Very, very up and up, very upstanding. Greg is been doing this for a long time. He knows what he's doing. He has a great team, both in this house, outside this house. So I highly recommend it. If you're in pain like I was, seek him out. He has the answers. And hopefully Dr. Salmon and Greg can help with those problems.
Well, I do all the facilitating of getting everything together to give it to the doctor, and then, of course, he takes over from there.
Right.
But I would like to thank you very much for doing the testimonial today.
Oh, sure. My pleasure. If anybody out there needs to contact me to make a decision whether or not to have Greg and Dr. Simone help, feel free to give out my number, and I'll be happy to give any kind of recommendations to whomever.
That's very nice of you, and we certainly appreciate you watching the video today. And thank you very much. If we can help you, please contact me at gregorypope@spinalsurgerymexico.com, or you can give me a phone call. It's area code 772-419-8061, and thank you very much.